name is Dr. John Murebi. I work with the Tibabu Health Consultancy. I'm a doctor of physical therapy and partnering with the Ponea to talk about food assessment of food biomechanics. When assessing food, you need a lot of tools for this assessment. In the hospital setup, we use X-rays, MRIs, and other radiography assessment to see whether the food has got any pathology or any issues or any disability. In our physical examinations, we use questionnaires like food posture index, whereby we want to know the level of the pronation and the supination of the foot. Sometimes we use other rules like Ottawa ankle rule, whereby it rules out the fracture and its sensitivity is almost 99%. Other times we use hand technique to assess whether patient has issues of the foot, because when you get these problems, they can even bring other issues like back pain, neck pain, and knee pain. Tools for assessment during physical exams, we can use, let's say for example, patient can come in with maybe swelling of the foot and ankle, and maybe you don't want to expose this patient to radio waves, so we can use the Ottawa ankle rule, whereby the Ottawa ankle rule is used to describe and try to see whether this patient has any fracture. First, we check on the lateral malleolus 6 meters away to see whether there's any swelling. On the medial malleolus also, on the fifth metatarsal and the navicular bone. Once the patient complains of these 4 structures, this patient is prone to a fracture, and if the patient has any inability to walk few meters away from the emergency or the accident area. There are very many pathologies of the foot which can bring a lot of issues, and as we have said, foot is the only thing which can lead you to the road to Damascus in the Bible. So we're starting from the back of the foot, because foot is divided into 3 parts. We have the hind, the rear, and the front of the foot. The hind part is the calcaneal bone, which can bring issues like maybe you have heard of people complaining of pain at the calcanea. When they try to step down in the morning, there's a lot of pain. We call it Savier's disease. We have the conditions like they are called fatty pants calcanea issues. We have things like angular deformities. We have issues like plantar fasciitis, the one that we call flat foot. We have other issues like maybe a fracture on the metatarsal bones. All these are pathologies that involves the foot. And also, there are other pathologies that can come as a result of maybe shortening of the calf muscles, because we see the tendons of the calf muscles, they insert at the foot, at some of those joints. And even sometimes, the syndesmotic ankle sprain can be one of the pathologies for, let's say, for example, players who play football and other huge and difficult games. On the terms of management, there are very many ways of managing foot pathologies. One, there are those that need conservative management, other need surgery, and other need home care. To start with the surgery part of it, it's like maybe identify, we say that it's whereby maybe it's a fracture that has got a very big margin in the construction. The others which need POP, that is plaster of Paris. The others which need physiotherapy treatment, whereby, let's say, for example, is maybe a sprain of the ligament, sprain of the tendon, not sprain, but strain of the tendons. And then first, before we give the management, they need a proper assessment tool that we have already named them, so that we can know whether this pain or the conditions that the patient is complaining about is related to what, so that now we can know we are going to put them in which category, like maybe surgery, conservative management, or an home program exercises. Gait cycle and how people gait is how people walk. This is how people walk. People walk with when they put their foot on the ground, they start with the initial contact on the ground, mean distance, press swing, then toes off. So if you don't obey to this rule. You have a problem, you have a pathology with your foot. So how do we manage them, and how would we recommend our patient? Sometimes we give sprint, sometimes we give foot orthotics, sometimes we give surgery, sometimes we give home remedy, sometimes we do taping, especially for those players who do football. We can do a lot of taping to them so that at least we can hold structures which has either a sprain or a strain. Thank you for joining us in this discussion. You can look for us through poneahealth.com for any engagement or for any assessment or any type of treatment that you would want us to do as regarding to musculoskeletal or foot biomechanics. We are ready for you.